Good morning, everyone. As Christine's letting everyone in, we got another minute or two, and then we'll get started.
Oh, Van, it looks like Dr. Benjamin's here.
Oh, wonderful.
I'm letting him in. Okay. I think we're good.
Good morning, everyone. I've got 9:01. I think we have a surprise guest. Dr. Georges Benjamin, I think, was able to join us this morning. Good morning, Georges.
Good morning, everyone. How are you?
Wonderful. Thank you for giving us a little bit of time,
All
and
right,
we look
thank you.
forward to a wonderful year with you on board.
Well, I'm excited for it, about it. Absolutely.
Great. Okay. I'm going to call the meeting to order for the PDAB special meeting, which, as most of you know, is for our presentation of our annual report and was going to also be for our extension of our office lease. However, there's still some negotiations going on with DGS and the owner of the building. So we'll probably present that at our January meeting. Our lease isn't up until February, so we do have some time. So the only item on the agenda today for presentation and a vote is the annual report. Christina, I know there was some written comments sent in that you distributed to the board. How about for public comment? Do we have public comment?
Yes. So we received four written comments that were provided to the board, and they were also posted to the website. We also have four people registered to provide oral public comment today. Each commenter will have 1 minute and 30 seconds to speak, and I will call on those that are attending. Oh, sorry, we're not in person today, so sorry. I will call on those in alphabetical order. Once I call on you, please state your name, the organization, agency, employer, or other entity in which you are affiliated with, if any, and whether you're a consumer, and then the agenda item that you would like to address, and then you can start your comment. So I'm first going to start with Derek Flowers. Mr. Flowers, are you here today?
I am. Thank you, Christina.
Great. And you, do you want to just state the entity that you're with and then the agenda item you're addressing, and then we can
Sure.
begin.
Yeah, thank you. Derek Flowers with the Value of Care Coalition addressing the annual report.
Morning,
Great.
Derek.
Oh,
Thank you. Thank you, Christina, and
okay.
members of the board. Good morning. Thanks for the opportunity to speak. As I said, I'm Derek Flowers with the Value of Care Coalition, a network of patient, provider, and caregiver organizations. We appreciate the board's stated interest in the non-UPL policy options, but more than 2 months after the board directed staff to produce plans to implement those specific non-UPL policies, there's still no timeline, no framework, and no public progress. The annual report only deepens concern. It lists 3 non-UPL policies the board decided to pursue in September, yet later recommends a different set of policies to the legislature, including only one of the board-directed policies. Those inconsistencies undermine confidence in the board's stated commitment to a broader affordability agenda. While it reports clear movement on UPLs to the legislature, there's no comparable pathway for non-UPL policies that the board is pursuing. It's also inconsistent with repeated assurances that UPLs are just one tool in the PDAB's toolbox and with statements from staff to lawmakers during the October 2024 Legislative Policy Committee meeting. It was stated then that non-UPL policies would advance, quote, in parallel circumstance to upper payment limits and were, quote, just as important as upper payment limits, if not more. So the question is simple. When will the board follow through on these statements? Patients and legislators deserve clarity. We urge the board to publish time-bound implementation plans for all non-UPL policies alongside any UPL proposals and include that plan and progress in the annual report to the legislature. Thank you for your time and for your consideration.
Great. Thank
you.
you, Derek. Appreciate it.
Up next, we have Mr. George Huntley. Mr. Huntley, are you here?
Yes, good morning. Thank you.
Can you please state the agency that you're with and then the agenda item that you are speaking to?
Yeah, I'm with the Diabetes Patient Advocacy Coalition and here to speak on the comment on the board's annual report.
Okay, you may begin.
Thank you, Chair Mitchell and members of the board. I appreciate the opportunity to comment on the annual report. We strongly support the legislative recommendations on drug pricing, transparency, patient navigation services, and biosimilar competition. We want to make sure that actually gets to the legislature. First, on transparency, policymakers and patients need visibility into what drugs actually cost after rebates and discounts. Without that data, it's impossible to design reforms that ensure savings reach the patient at the pharmacy counter. Second, a statewide navigator program could make a real difference by connecting Marylanders to assistance programs and helping them manage complex insurance barriers, especially people with chronic conditions like diabetes. Third, promoting interchangeability and fair reimbursement of biosimilars will help lower cost alternatives to market or bring those alternatives to market, but those savings only matter if patients can actually access them. So we also encourage the board to include in its final report a recommendation to delink PBM compensation from rebates, so PBMs are paid based on services and not the size of the rebate. We respectfully ask the board continues to move forward with drafting a methodology for upper payment limit frameworks that you give equal weight to evaluating all the non-UPL approaches presented to the board by its staff in the September meeting. We have a chance to really take a lead in the nation by showing that true affordability can be achieved without compromising access. Thank you for your time.
Thank you. Up next, I have Mary Morlino. Ms. Morlino, are you here with us today?
Yes, I am.
Great. Can you please state the agency that you are representing and the agenda item that you'll be speaking to, please?
My name is Mary Morlino, and I'll be speaking to the overall board and the actions that they have related to the rare disease community.
Okay, you may begin. Thank you.
Thank you for the opportunity to speak to the PDAB board. Again, my name is Mary Morlino. I am a rare disease patient living with sarcoidosis, as well as an active advocate and founder of Maryland Rare, which supports the rare disease community of Maryland. I've also worked with patients I've also worked as a patient concierge and navigator in the rare disease space. I've worked directly with thousands of rare disease patients and have a good understanding of the challenges they face. And I'm also a consumer of Jardiance. While patients support affordability, there is concerns that the PDAB decisions may not fully reflect the complexities of rare diseases, a small population of patients, or the lack of substitute treatments. Patients have serious concerns because efforts to cap drug prices may intentionally limit access to rare disease treatments, which often have no alternatives. Families fear that manufacturers would pull therapies in Maryland where the price caps are set too low, leaving patients without life-saving medications. This creates fear that policies intended to help could actually reduce access to critical care. What the rare disease community would like is common alternative safeguards proposed in the rare policy space, including explicit exemptions for special standards of care, mandatory rare disease advisory input before any UPL, focusing on PBM transparency as
Oh, I'm
you're gonna
sorry.
stop me, right?
You can
Yes,
finish.
thank you. Yeah.
Okay.
Good.
So focusing on the transparency, rebate pass-through, copay accumulators, maximum reforms to savings reaching each patient. As we know, drugs don't work if people can't afford them. Thank you for the important work that you do.
Thank you.
Thank you. And then lastly, we have Tiffany Westridge Robertson. I believe I just saw you join. Tiffany, are you here with us?
I am, but I'm going to pass on speaking this morning. I did not prepare anything.
Okay. Thank you. That concludes our oral public comment for this morning.
Great. Thank you, Christina. And thank everyone who participated. I actually thought that they were all very enlightening. Derek, I understand your concerns. It's been a concern of the chair for a number of years. And I'll only just say that we'll continue to improve our process, and we will look for other alternatives other than upper payment limits. Andy knows it's a priority. We sometimes, unfortunately, have a limited staff, as all of you know, and have been shorthanded most of the year, at least one or two. When you have one or two gone out of four, it really disrupts a lot of things. No excuses, but hopefully we will make some more progress in regards to the rest of the items on our agenda over the last year or so. So with that, Andy, let me turn it over to you for the annual report presentation to the board.
Great. Thank you, Mr. Chair. So staff prepared a very brief presentation to just summarize some of the key findings of the report. And as you mentioned, the purpose of today's meeting is to approve this report. It's due annually by the end of every year. Christina, if you want to go to the next slide. So every year before December 31st, the board shall submit to the Finance Committee and the House Health and Government Operations Committee a report that includes the price trends for prescription drug products, the number of prescription drug products that were subject to board review and the results of the reviews, and then any recommendations the board may have on further legislation to make prescription drugs products more affordable. So we were able to address these issues in our annual report, and I'll summarize the key findings in the presentation today. Next slide. So we summarized some national health trends based on published data. The U.S. pharmaceutical expenditure grew by 10.2% compared to 2023, totaling $805.9 billion. We outlined some of the top drugs for overall expenditures, including some of the GLP-1s and also Humira and its biosimilars, Eliquis, and then also Jardiance. The literature also notes that prices had a slight overall decrease, and net price growth was overall flat. And then also, we continue to see significant barriers to medication access, as patients do not fill over half new prescriptions for novel medicines due to benefit design and high costs. So again, just reiterating a lot of the findings that we've seen over the year. Next slide. I did want to note that we are still onboarding our data analysts. So we don't have any of the Maryland state-based trends at this point, but we'll look forward to publishing those as soon as they're available. Until then, we will continue to use the national literature as we did in this report. We provided a quick update on the regulations that we did, our regulatory work over the years. So we updated the cost review study process to account for the policy review process. So we presented our upper payment limit plan at the end of last year, and then put that plan into action at the beginning of this year through our regulations. And then we also created the new chapter regulations on the policy review, the final action, and upper payment limit. So those were the regulatory updates for the year. Next slide. We continued the cost review study for the first 6 drugs that were selected. For the first 4 drugs, Farxiga, Jardiance, Ozempic, and Trulicity, the board made their preliminary determinations. And then for the last 2 drugs, Dupixent and Skyrizi, staff is currently working to publish the dossier, and we expect this process to be completed by early 2026. Next slide. We listed the different preliminary determinations that were made. So I don't need to go through these, but just flagging that those are articulated here. So this is the preliminary determination for Farxiga. Next slide. This is the preliminary determination for Jardiance on the affordability challenges. Next slide. For Ozempic, in our last meeting, we made the following preliminary determinations, and then same thing for Trulicity on the next slide. Here are the preliminary determinations for Trulicity. Next slide. We did begin the policy review process for Farxiga and Jardiance. We held two public hearings in 2025 and looked for possible policy actions. And we also got board and stakeholder council input, and then also board staff researched and analyzed potential policy options and made policy recommendations to the board for board approval. Next slide. The board, as part of that process, recommended moving forward with exploring an inflation penalty, a patient navigator program, and then also delinking PBM compensation from rebates, as well as moving forward with an upper payment limit for Farxiga and Jardiance. The staff presented the upper payment limit framework in our November 2025 meeting. And the next step is for the board to publish the methodology documents for public comment for upper payment limits for those two drugs, which we expect to happen in the next few weeks. Next slide. We just wanted to note that we did have legislation in the last session related to prescription drug pricing specifically, and also relevant to the affordability, the Prescription Drug Affordability Board. SB 357, authority and stakeholder council membership, added new members to the stakeholder council that went live in July of 26, and then also created a mechanism to expand the authority from the board from setting upper payment limits for state and local government to the entire state. This authority is contingent to setting an upper payment limit on 2 prescription drugs for at least 1 year. So I did want to note that that was some major legislation in the past session. Next slide. We, in these reports, have started to try to identify key themes that are kind of big themes throughout the year that affect drug affordability. In this report, we walked through updates on the Inflation Reduction Act. So we had the first 10 drugs. Those prices were announced at the end of last year. They're expected to go into effect on January 1, 2026, actually, I think is correct for that one. And then also the negotiated prices for the next 15 drugs were just released. And they were released in the process of our draft report being published. So we actually were able to update a version 1.1 of this draft, of this report that includes the 15 negotiated, the prices for the additional 15 drugs. Also, we noted the 340B drug program, the rebate model pilot. And then also, obviously, tariffs were a major discussion point. And then there's also been, related to tariffs, the move towards direct-to-consumer sales for certain medications. And then also, there are continued efforts to increase transparency in the space. Next slide. In this report, we included thank you. There's some other key themes are the GLP-1s continue to be a major talking point because they are a potential driver of prescription drug spending. The biosimilar market continues to be a major issue. It's continuing to grow, but we continue to see issues and barriers that cause the market to not function continue to see barriers to competition in the market and uptake of biosimilars. And then obviously, pharmacy benefit manager reform continues to be an issue. There have been discussions at the federal level, and then also continues to be many discussions at the state level on different areas of PBM reform. Next slide. And in the last thing that the report does is make recommendations on potential legislative action. In the report, we focus on what could happen in this upcoming legislative session, and staff may be able to push forward with legislation around prescription drug cost transparency, patient navigation services, and then also biosimilar interchangeability and competition. The actual policy recommendations for the different drugs I know this was addressed in some of the public comments. The way that the staff made these recommendations was, since the cost review studies are still ongoing for some of the drugs, or all the drugs, the legislative recommendations were based on feasibility and timeliness, basically. Cost transparency has been an ongoing effort of the board. And I think this session may be a time where we can move forward with some action there. The page navigation services, again, long-term action of the board, but then also learned about some specific things that we can do based on some of the informational hearings and some of the work that we've done for the drugs under cost review. And then finally, biosimilar interchangeability, again, is a very topical issue, and I think there are state things that can be done at the state level to increase competition. So the full annual report is posted on the board's website, and we look forward to any feedback or questions that the board has.
Thanks, Andy. Let me ask board members, do you have any conversation, discussion, specific questions about what Andy quickly ran through?
This is Jerry Anderson. I think we have a lot of data on the rate of increase in in prescription drug spending, but we don't have as much information about how it's affecting the people in Maryland. So I think as we move forward, we need to talk more about how affordability problems are affecting people in Maryland. The second, and this is just a minor thing, in the text it says the drugs that are entering the market are significant. Some of the drugs are very significant, but some of the drugs are much less significant, are just basically Me Too drugs. So I would not use the word significant generally for all new drugs.
Dr. Anderson, are you making a proposal with respect to the draft report on a particular page?
Yes, it's the word significant is the change that I would eliminate. I think it's on page 2. I don't have it in front of me.
Jerry, just for clarification, are you working off of Andy's PowerPoint or the actual report?
The actual report.
Okay.
So am I understanding that you are moving that the draft report be modified to strike significant as a modifier to drugs? And let me make sure
that is correct.
Do you want to substitute a word, Jerry? That'll make it easier.
No, I just think you could take out the word significant.
Okay.
Yeah, I think he's looking to eliminate a word.
Right. Okay. Didn't know if you wanted to replace it.
I do not need to.
Has somebody on staff got it where Jerry's talking about? What page? Page 2?
I believe it's page 4.
Page 4.
While net prices growth was flat, increased use of medications with significant clinical benefits drove the acceleration in spending. Does that sound right, Jerry?
Yes.
Yep. So we'll strike significant from that line.
Okay. Anyone else have any comment or questions or suggestions?
My only comment would be to concentrate and continue to concentrate on the transparency of PBMs and the rebates and where they're going and who's actually getting them, et cetera, et cetera.
On my end, a comment on the annual report itself, and then something kind of just for looking ahead. So page 18 of the report, and then the sections after that have specific areas where staff will be investigating over the next, I guess, many months. Tariffs being one, DTC sales being another, and so on. And then at the end of each section, it talks about staff continuing to monitor. And using the first one there is an example. Just at the bottom there, staff will continue to monitor any impacts that pharmaceutical tariffs may have, and then so on and so forth. I would encourage us, if possible, to add sources. So we're not necessarily monitoring the impact, we're monitoring the evidence that's available. So to the extent we can be transparent as to what evidentiary sources we're using across those different sections, I think that can be helpful. And then a general comment, in our presentation as well, Andy, you mentioned, the role for thinking about benefit design, getting greater visibility to out-of-pocket costs and things. These are related to things we've discussed as a board over this past year. And I think kind of challenging ourselves in 2026 to get beyond claims data that's national. Jerry mentioned thinking about Maryland data. And to that point, I think we need to be looking more at survey data. So MEPS being one, Medical Expenditure Panel Survey. And even with the national data, getting better visibility to the role of benefit design, that's possible with claims. And then one can do that specifically for Maryland in claims. And then on the out-of-pocket side, there are a number of data sources for that as well, looking at patient-reported out-of-pocket costs. MCBS being one, has public use version, and then MEPS, of course, is available. So I would say, in addition to wanting to get more specific to Maryland, really thinking broader about measures, so the benefit design piece, and data sets.
Okay.
Great.
Andy, was there anything from last year's report that was significant from the legislature that you've incorporated into this as far as recommendations or anything?
No, last year's report did not have any recommendations. I think we were kind of just in the middle of implementing the upper payment limit action plan. So that is a major difference this year, is that we do have recommendations on the transparency, the patient navigator program, and the biosimilar work. So that's an update for this year.
Okay. And just for the board's purposes, Andy, Christina, and I have had conversation, obviously at staff calls, but we've also had different ones of us have had conversation with some legislators and the governor's office on some of our initiatives. So as most of you know, there's a process that has to go through with legislative packages. So from an administrative standpoint, so we're kind of in the middle of that at this point in time. So we'll keep you posted in January as to what's going on with that. Anything else in regards to the report? Hearing none, I'll entertain a motion with Jerry. You might want to make it with the amendment on page 4, the striking of your word.
So I move that we approve the report, striking the word significant on page 4.
Is there a second?
Second.
Second by Stephen. Any other questions? No. If
Mr.
not,
Chairman,
yes.
I'm assuming I should abstain from the vote.
That's up to you. If you want to, we're happy to show that for you.
Yes, why don't we do that?
Okay. Let me call the vote. All those in favor, aye.
Aye.
And there's one abstention. Dr. Benjamin?
Thank you.
Vote passes. Report passes. Thank you very much. Anything else, Andy, in regards to the report?
Nothing else from the report. We'll get it submitted as per the General Assembly's procedures.
You want to give a quick 2-minute update to the board as to where we are with filling out the rest of staff and anything for year end? Not
Sure.
that it's our fiscal year end, but the calendar year end.
Yeah, so I think we introduced our newest team member, Chidera Agwu, at one of our previous meetings. She's been onboarding, and a lot of that is just getting access to all the right tools and data sets. So very excited to have her on board. We are also actively interviewing for our administrative specialists. So we have to plan to have them onboarded by the end of this year. And then to the chair's point, we will be fully staffed and look forward to a strong 2026 moving forward. In terms of the rest of the activities for this year, so we do hope to publish different materials. We're trying to publish the methodology document or the UPL methodologies for Farxiga and Jardiance. We have posted our 2026 meeting dates for the board and I believe also the stakeholder council. For the board, it remains the fourth Monday of every month, pending a couple holidays. And then we do have one more stakeholder council meeting scheduled for this year. That's going to be on December 15th. Where the stakeholder council can weigh in on drivers and policy solutions for the affordability determinations or the preliminary determinations made by the board on Ozempic and Trulicity. And then on the 16th, we have a public informational hearing on the allowing the public to weigh in on those same issues, weigh in on the drivers, the affordability determinations that the board made, as well as any potential policy solutions to address to respond to those drivers. So that's kind of what we have through the end of the year, and look forward to closing out these 6 drugs and starting the process for the next round.
You want to take just a quick second and explain it, especially for Dr. Benjamin and others that are new on the call, what you're doing with this hearing, and that you're doing a morning or kind of an early afternoon and a later evening. So you'll have 2, but they'll be the same.
Yep, thank you. So our informational hearings are a step in our policy review process and the information gathering step. So the board made their preliminary determination on affordability challenges for Ozempic and Trulicity. So the next step is for staff to gather information to try to identify the drivers, i.e. what is the affordability determination is the kind of the what, like what did the board see in the data that indicates there's an affordability challenge, and then the drivers are the why, what kind of market circumstances exist that are causing those affordability challenges. So we have the stakeholder council input on Monday, and then on Tuesday we have an informational hearing where the public can register and provide their input. So this is an important way for us to get input from the public on these issues. To the chair's point, we have an afternoon session and an evening session for the folks that are not available to attend the afternoon session. Christine, I'm not sure if you have off the top of your head the deadline for registration.
Yeah. Yes, I do. I actually just put that in the chat. So all written comment and public oral comment for the PDAS meeting is due this Wednesday, 12/10. Also, the sign up for the informational hearing is this Wednesday as well. And that's a Google form on the website. Please sign up through the Google form if you want to testify. The registration to listen, those Zoom links are also posted on the website. So everything is this Wednesday.
While you had the floor, Christina, I know Andy mentioned the date of 12/15 for your next meeting with the council, but in the report, it was also mentioned that the legislature expanded the number of seats on your council. Do you want to spend a minute to talk about those 2 seats and where we are as far as naming new people to the stakeholder council?
Yes, so we received 3 new stakeholder council seats due to the bill expansion in 2025. One is for rare disease, one is for oncologist, and then the last one is for patient advocacy. That patient advocacy position has been filled. I am still waiting on appointments for the rare disease and the oncologist position. And I'm working with the respective appointing offices on those.
Great. Very good. Thank you. Next, we have our next meeting will be virtual because session will be back in. So our room won't be available. So it'll be January the 26th at 2 p.m. we'll send out obviously the information and the link to register prior to. And with that, I think probably everyone knows at this point in time, but maybe some of the folks that aren't on the board, we accepted Barry's resignation to the board Monday, December 1st for the end of the month, 12/31. And I just want to say a few words and turn the floor over to her. Many of you know she's been an extraordinary talent to the board, has given a lot of her time for a small group of people, and her expertise in the subject matter has been very, very helpful over the last 4 or 5 years as we've stood the board up and tried to make progress in this really, really difficult process. I'll miss her. I know the rest of the board will, but I know she's got her hands full with her job and cuts, and we appreciate her giving us the time. She told Andy and I this fall we have been in contact with the Speaker's office. As many of you know, the Speaker is stepping down, and I think it got too close to that point, and Adrian wanted to let the new Speaker make the appointment. So we have resumes into the Speaker's office, and we hope that within the next 30 days, we will have a replacement for Barry. But Barry, let me offer the floor to you. And again, on behalf of all of your colleagues, and we'll do a resolution from the board at the January meeting, but let me turn the floor over to you.
Thank you, Van. And I appreciate just having a couple of minutes on this meeting. This was not an easy decision, but I wanted to provide it as soon as I thought it was necessary, and really have appreciated you and Andy's time this fall. The board's work is not easy, and that is something that I understood stepping into this role several years ago, but a challenge I wanted to take on because I feel that I had something to contribute, and I wanted to help in any way that I could. So it's really been an absolute pleasure and an honor to work with everyone. I remember the early days with Chris Valicillo, Jim Johnson, really standing up this board and bringing on really talented staff to the staff we have right now. And even just reviewing this year's report, reflecting what we've accomplished over those several years is really quite amazing. The focus I brought was on the data, and several conversations, both internally and at our meetings, on the challenges with data, both logistical, operational, timeliness, providing context to that data, getting patient input. How do we do that in a way that's intentional, inclusive, equitable? These are not easy. And I think a lot of times it's hard because it requires some level of structural change to the system. And I really just have appreciated, Andy, you and the staff's openness and intention with a lot of the conversations we've had. So I definitely will be keeping an eye on the board's work. And I wish the board members, both those that are here and those to be appointed, the staff, the stakeholder council, really all the success. Your work is important now more than ever. So thank you again for the opportunity.
Thank you. Let me, before I go around the horn, so to speak, let me again recognize and thank Dr. Benjamin for taking his time to agree to be on our board. Most of you know he's extremely busy. And we are just so pleased that with his background and his expertise and his demeanor, that I welcome him as a board member and look forward to a lot of very good dialogue. So Georges, again, thank you very much for taking the time this morning, and we look forward to a robust 26. So with that, let me we've heard from a Barry. I'm not going to call on her again, give her another bite of the apple. But Stephen?
Yeah, I just want to say that I've enjoyed very much working with her over the last few years. Her input has been always right to the mark and very pointed to get us going in the right direction. And I'll certainly miss her.
Jerry?
Barry and I, along with Van, were the first original members of this group, and it's been a long process. Barry, we're going to miss you, but because of your work, I think we're much better off. And thank you very much.
Great. Georges?
I just, thanks for the opportunity, Van, and colleagues for allowing me to participate on this. This is a fascinating project, and I'm glad to be not quite on the ground floor, but certainly in the early activity that you're doing. So I'm really looking forward to it.
Great. Thank you. Andy, is there anything else that staff or you need to discuss?
Nothing else from
If not,
staff.
I'm going to wish everyone a safe and healthy holiday season. This concludes our work, at least as a board, for 2025. Staff's got a lot of work to get done between now and the end of the year. We look forward to seeing everyone in January. With that, I'll entertain a motion for adjournment.
So moved.
Move. Second.
Second.
All those in favor, aye.
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 Thank you very much. We stand adjourned until January 26th. Thanks, Barry.
Thank you
Appreciate it.
again,
Thank you.
Barry.
Thank you all.
Bye-bye.
All the best.